Hello and welcome. For this video, we will be looking at the different ways that you can introduce the cannabis plant, specifically CBD, to your body, and what you may want to consider in regards to the advantages as well as the disadvantages of each route, and why you may want to consider one over the other depending on your needs. So stay tuned and let's just jump right into it. So again, hello and welcome. If you're new here, if you're not, welcome back. I am Dr. Jack. I'm a board certified anesthesiologist and pain management physician. And we are continuing this series on CBD education. And for today, we will specifically looking at the different routes or the different ways that you can introduce CBD to your body. We will talk about orally as well as inhaled or vaping, and also sublingually or under the tongue, as well as transdermally. You can also take CBD rectally, but it's not really suggested. And even though there are certain advantages to taking any type of nutrient or anything rectally, but that's might be a separate video. So anyway, without further ado, let's start off by talking about the oral way of taking CBD. So you've decided to take CBD orally or in a capsule form, and what are the advantages, what are the disadvantages? Well, real quick about digestion. So whenever you consume something, it goes down the esophagus and there's a motion called peristalsis, which basically brings it all the way down into the stomach, and that's where the acids break it down. Now, when it's broken down, it's introduced to the liver and you get what's known as the first pass effect through the liver. And this first pass effect actually destroys a significant amount of the CBD that you are consuming. Anywhere from 4 to 20% is the bioavailability that's left over. So bioavailability is essentially how much of the active substance is left that is circulating within your, circulation. And so quite a bit of it is lost through that process. Other thing you should know is that depending on whether or not you had a fatty meal and what type of fatty meal, the absorption rate or bioavailability can vary anywhere from 4 to 14 times. It typically takes about 30 minutes to 2 hours for it to start getting into your bloodstream and actually having an effect. And as far as the advantages, the advantage is that it's very easy to use, right? A lot of us are used to taking pills. You can take it with you on the go and just take it as you're going. And the other thing is that it does seem to have a higher level of the cannabinoids at the brain level when you take it orally, and it does seem to last longer as well. So let's focus on inhaled cannabis or CBD. So the advantage is that it bypasses the first pass effect of the liver. So you do get higher bioavailability, anywhere from 10 to 35%, but that range can vary quite a bit. It can go from anywhere from 2 to 56%, and this mainly has to do with the sort of breathing dynamics, if you will, or inhaling dynamics, where the amount of time that you hold the product that you are vaping or smoking, or how big a breath you take, all have a pretty wide variation. And you can reach peak plasma levels within 3 minutes. And so this is about as quick as it can get in regards to having an effect. And the reason is that when you inhale something, it travels down through your lungs and reaches these tiny little air-filled sacs called the alveoli. And at the alveoli level, there is sort of the air-blood interface. So you have a blood vessel running underneath it as well, or around it. And that is where essentially anything that you inhale gets into the bloodstream extremely quickly. So when we talk about this, we're talking about things like smoking, such as CBD cigarettes, as well as using it through a bong or a pipe. And when you do that, there has been studies to show that the breakdown products of smoking essentially lead to inflammation as well as potential lung injury long term. The American Lung Association actually states that anything that is smoked and brought into the lungs can potentially cause lung damage. And as far as vaping, this is where you have essentially a vaporizer and then a cartridge or some type of fluid that the CBD or cannabis is within. And when the two are put together, it is safer to vaporize as opposed to actually smoking, as it causes less lung injury. However, you do have to be careful, because a while back, when you may have heard about people that were vaping and having severe lung injury, and some people actually died from this, it was mainly due to kind of low quality products having something called vitamin E acetate that was causing that damage. So definitely do your research and make sure you're getting a safe quality product. So as far as sublingually, this is the preferred route that I suggest to my patients of how to take CBD. And the reason is that you can get a bioavailability anywhere from 13 to 35%. You can have peak plasma levels within about a couple of hours. And most people notice that it begins to have some type of effect within 30 minutes, it seems, at least clinically. And then the way it normally comes is within a bottle, and there's normally a carrier oil, such as MCT oil, and you put it under the tongue, and you want to hold it there and let it absorb sublingually or under the tongue. And you want to hold it there for a count of about 60 to 90 seconds. So I typically tell people to just, squirt it under the tongue and lay down and count 60 Mississippis or so. What I like about it is that it gives you a more consistent dosing. So it's not like when you take CBD orally, where a fatty meal can create that 4 to 14 time variation in regards to the absorption and bioavailability. This is something that you can put under the tongue consistently, and a fatty meal will not affect the amount. And the name of the game with CBD is that you want good, consistent dosing for a period of time, as opposed to big peak, kind of peak and troughs of the plasma level of CBD. So I think it leads to a smoother and kind of better long-term outcome, if you will. The disadvantage of this that I have found is that some people just really can't tolerate holding an oil underneath their tongue, and it is cumbersome because you have to, draw it up, squirt it under the tongue, lay down, sit there and count, hold it under the tongue. And so, it's a lot easier to say take a capsule or something like that. But still, this is the route that I would suggest if you are to consider trying CBD. So next, let's cover transdermal, which means through the skin. And when we talk about transdermal, for the purpose of this video, I'm mainly talking about CBD pain creams as well as CBD patches. And there's also lotions and salves and all these other things out there, but I'm focusing on the CBD pain cream and patches for the purpose of this. So the CBD pain cream, what I have found is that works well for areas where there is very little subcutaneous tissue or fat. And those are areas like the hands or any type of joints like the elbows or knees and places like that. And it also seems to work well for various muscle aches and pains. The patches, honestly, they're quite expensive. The vast majority of people have not found it very financially doable to use the patches, but basically a patch you stick on anywhere on your body, and basically what it does is it absorbs into a bloodstream to give you consistent sort of release of CBD. And the disadvantages are that the big one is that it can take a little while to work for something like a transdermal patch. Typically the CBD pain cream seems to work rather quickly, because at the very least there is a lot of these companies will put something like menthol or something in that, and it makes it work rather fast. So just kind of wrap things up, I do want to say, if you do like this video and you found it helpful, please like and subscribe, especially liking it, because it really helps the YouTube algorithm and get this video out to more people, and it really helps support the channel, so I greatly appreciate it. But to wrap all of this up, ultimately what works best for you is the most important aspect. And so there is no right one way to introduce cannabis or CBD into your body. there are advantages and disadvantages to each route, but again, I suggest the sublingual route, probably followed very closely by the oral route in a capsule form, and then also, again, the pain creams, CBD pain creams, as well as patches, I feel like also have a place. If you're going to choose to introduce it in a, inhaled version, I do suggest you be careful. It's not really the route that I would suggest, but some people do prefer it. And so that wraps up this video. I hope you found it helpful. Stay tuned for future content, and I look forward to seeing you next time. Till then, stay safe, take care. Bye-bye. Pura Vida.